Welcome back. You're watching McLaren Port Huron's Today's Health, and I'm talking with board-certified interventional cardiologist Ramesh Reddy, and we're going to be talking about heart attack. Okay, Dr. Reddy, what are the symptoms of a heart attack?
Heart attacks can present in multiple ways, but the commonest symptom is an uncomfortable feeling in the chest, a pressure or a heaviness that seems to persist and doesn't go away. Sometimes you can break into a sweat. You can have just shortness of breath. Sometimes women have a slightly different presentation. They may just have nausea or just a discomfort in the lower chest or upper stomach area. So a variety of manifestations, but the most important thing is an uncomfortable feeling in the chest or chest pressure that occurs either at rest or with activity.
So it's either if you get up and move around, it's the same as when you sit down, it's still always there.
It could get worse when you get up and move it down, but mostly it presents itself as a heaviness and pressure in the chest.
Okay.
That doesn't go away.
And what should you do if you think you're having a heart attack?
If those symptoms come on, I think the best thing would be to call 911, sit down, and if you have an aspirin, take an aspirin and wait for the EMS to arrive. And probably a good idea to open the front door so they have no problem having access to come in and get you if you're alone. If you have a family member, have them make the phone call, leave the door open, take an aspirin, and just lie down and rest. That would be the best way to go.
And is there ever a time that your family member or someone should even think about CPR if you stop breathing or fall over? How do you handle those situations?
You know, CPR saves lives, but it has to be done by somebody who's comfortable, familiar with it. Sometimes in moments of panic, even a family member who knows may not be able to do it. But yes, it does help. Have somebody lying flat on a flat surface and initiate your CPR. And calling 911, sometimes the EMS also can guide you if they are able to on the telephone. So that would be a reasonable approach. But I would go ahead with an aspirin, open the door, wait for the EMS to come and get you. And they're pretty quick in this county.
Well, you know, I'm guessing you would have so much anxiety that if I'm close to the hospital, why don't I just jump in the car or have my husband put me in the car and off I go?
You know, that's a very valid question. Heart attacks present not only with chest pain, but they also present with arrhythmia. When you say arrhythmia, it's a very irregular, rapid heartbeat that could be fatal. So if you're driving yourself to the hospital, there is a good chance, unfortunately, that you may have one such arrhythmia that goes along with a heart attack, and you may actually pass out, hurt yourself, hurt the person on the other side of the road. So driving yourself is not a good idea. 911 and have the family member be with you while 911 is doing the action of dispatching.
What happens once you get to the emergency center then?
We have a very good system at McLaren. Once the patient is actually picked up by 911, but the EMS comes to the house and picks up, they have the ability to perform an EKG on site or even in the truck. That EKG is transmitted immediately to the emergency room. The ER physician looks at the EKG, and if it is indeed a heart attack, then he alerts the team. We have a STEMI call alert in the hospital that goes out to the cardiologist on call, and the entire team is alerted. In fact, they literally greet the patient as they come in, and they take him straight to the cath lab if the lab is open. Otherwise, they do the preliminary work, starting an IV and things like that, and then send him up to the cath lab.
Why is time so important?
See, unlike a lot of other tissues in the body, for example, like the liver, heart muscle is very precious. Once it dies, once the damage occurs, it cannot come back. So time is muscle.
Okay.
And that's why it's so important to move fast.
Once you get to the cath lab, can you describe for us the angioplasty procedure?
Sure. Basically, it's a blockage. Maybe we have some slides if you can run them through for us. This is a picture that tells you how the arteries are, one on the right and one on the left. And we actually have a angioplasty images coming up. This is a normal looking artery with blood flowing through. This is a small tear in the inside of the artery, initiating a clot formation, which you can see it here. And here there is a clot that has formed extensively, blocking the artery. Now, when angioplasty is performed, you will see how that is addressed. You have a critical stenosis here in the artery, and you will see one more picture of that. Right here is where the blockage is, So we actually advance a wire under the X-ray guidance to go through the blockage, beyond the blockage, and we open it up with a balloon, and then we advance a stent. You can see the stent coming there. It is at the site of blockage, opens up, improves the blood flow, and there you can see the more improvement in blood flow. So this is really a good depiction of how an angioplasty and stent is deployed.
It's really very dramatic. How soon do you know if this treatment is successful?
Right in the lab, when the artery is open, you know that you have improved the blood flow. But the actual recovery of the heart muscle, although you have a pretty good idea, it takes 4 to 6 weeks to come back to its full force. So immediate results, you know that the artery is open. There's improvement in chest pain. There's improvement in EKG. But the total coming back of the heart muscle will take a few weeks.
Do you always put a stent in?
Stent is really our first choice. We first open it up, we go through with the wire, open with a balloon, and put a stent. Stent is far superior to a balloon, so that is our goal. Almost every heart attack that we come and do the intervention.
And how long do the stents last then?
No, once a stent is put in, there is about a 95 to 93% chance of the artery remaining open. So there is a 5 to 7% chance the blockage can come back, and if that happens, generally 8 months to maybe a year. Now, after 8 months to a year, if the artery is open, just like any other area in the heart arteries, this area is also susceptible to have another blockage. So the risk is pretty much the same, but there is a 93 to 95% chance of remaining open. So stent is a pretty good, reliable methodology to open up the artery.
Can you open up more than one artery at a time during the cath procedure?
You can. It depends on the circumstances. Which is the artery that is blocked that we are working on? How much heart muscle is being supplied by that? How serious are the other blockages, which we call them as important but not culprit, as we call them. It's not the culprit blockage, but important blockage. So that's a decision we make during the procedure. But yes, it is possible to open more than one.
Sometimes does the patient have to come back and have it when their heart is recovered a little bit, maybe have another stent or two?
We call that as a staged intervention, and we find that there's another blockage. We already recognize it, and we allow this one to heal up, settle down, and we bring him back. Yes, that is a reasonable approach to do.
Do you still have to manage your risks?
After the heart attack, yes. I think that's called secondary prevention. You know you already had a heart attack, you had an intervention. Now it's all the more important to prevent another damage, because whatever heart muscle is left is very precious heart muscle. So as aggressive as you can, keep your cholesterol down, the bad one under 70, exercise, take your medications regularly. If you're a smoker, quit, and make all the lifestyle changes necessary. Your efforts should be very intense in preventing another heart attack, and that happens by modifying the risk factors that I just said.
So it's not possible if you have 3 or 4 stents in to just say, well, I've got these stents in now, and so I can eat what I want, and I'm not going to be at risk anymore because I have these stents.
No, stents are excellent, but they are not intended to infuse a false sense of security for patients. No, that's not the intent. Stents are providing you the relief. It is important that you make the lifestyle changes, risk factor modification. No, you should really not be indulging in indiscriminate eating and sedentary lifestyle. That's really not the intent of doing an intervention.
They need a picture of their heart on the refrigerator too, with their stents in it, huh?
Some patients do. We give them a picture before and after how it was. In fact, they tell me it serves as a very nice reminder for them as they make their lifestyle changes. So that's not a bad option.
Yeah, it's not a bad idea. Is there ever a time when you go in to place a stent or that you're unable to open the vessels and the person has to have further intervention?
It does happen. We have a success rate of over 95%, almost 97%, but there are some situations when you cannot open the artery. If you're unable to open the artery, your option is bypass surgery, but we like to stabilize the patient before rushing him through bypass surgery. So that option exists. It's infrequent, but yet that's an option that we sometimes take on if necessary, but happens less than 3% of the time.
You've given us such great information. Do you have any closing comments for our viewers?
Heart attack, this is a major killer. Number one cause of death in men and women in this county, in this state, and in this country. Do everything possible not to be a victim of this. Lifestyle changes, risk factor modification, active lifestyle, and enjoy every day that comes your way.
Thank you so much for joining us.
Thank you, Barb.
Hello, I'm Jennifer Montgomery, President and CEO at McLaren Port Huron, and I'm excited to invite you to come visit our brand new patient tower. Construction is complete and we are open to have you come visit us. We will be open for business on October 15th, but prior to that, please come see us on September 29th between 10 and 2 p.m. We have a variety of activities planned for you and your family, and there will be complimentary refreshments available. We will have valet parking out front and shuttle service available from nearby parking lots. I hope you and your family are able to join us for the celebration and grand opening of our new patient tower.